Jayden, should we start off by how are you taking care of your body, mind, and spirit right now?
We should. So, for me personally, my body, mind, and spirit has been quite simplistic. I've found myself back living with my parents, and for me, it's actually been a really good opportunity to spend, I guess, time with my family that I wouldn't have been typically, and also just making sure that I continue to practice self-care in the ways I would usually aim to, even though at the moment here in Australia, and I imagine most other places in the world, it's quite difficult to say exercise in the way many people would typically. But just trying to get out and do that sort of thing, and I guess give some sort of attention to other interests of mine that I usually probably wouldn't be, focusing on. So, how about yourself, Elisha? What have you been up to in terms of maintaining your body, mind, and spirit?
So in terms of body, I've cut out sugar, and actually that's maintained, and I find it a lot easier to do, to look after when you can control what you eat from home and cooking everything. Also in exercise, I have most fabulous little dog that I live with, so I'm living alone but with her, so out for a run or at least a play if I can't get out with her. I happen to be Christian as well, so I found prayer has been more important than ever at the moment, especially being alone and reminding that we're not alone, and setting my mind on bigger things each day when the things in front of us can be really challenging. And in terms of mind, this is really important to me because around 7 years ago, I suffered a trauma and lived with PTSD and depression for a while. And some of the environment we find ourselves in can be quite triggering for those who've struggled, especially so much time alone. So really kind of keeping note of that and the practices I've learned over time. Just if any of that loneliness creeps in, I've got friends and professionals I can reach out to if needed. So I've been quite intentional about this, recognizing this is a challenge. And actually as a CEO, I need to look after myself, and actually, especially leaders, we're talking about leaders today, really have to make sure they're looking after themselves in order to be there for those around them.
Definitely. And so I guess for those that don't know you, Elisha, can I ask you to introduce yourself and speak a little about the work you've done with YMCA before?
Yeah, absolutely. Well, I also happen to be Australian. So I'm loving that commonality between us today, but I live in London. And I'm so grateful to the YMCA and the work you do with so many young people around the world, and the leadership that Carlos has really brought in, prioritizing mental health, which is at the heart of what we do. So in 2018, I set up United for Global Mental Health, really as a global advocacy group. I was really shocked to discover there wasn't one. And actually in my previous jobs, I actually founded Global Citizen here in the UK, and ran the mental health campaign for the Royal Highnesses, the Duke and Duchess of Cambridge and Prince Harry. And so coming from a campaigning background and really noticing there was a gap on the global scale, and really being shocked about things like, I don't know if you know, around 2% of health budgets, which are not even high enough in and of themselves, as we're learning now, only 2% of average health budgets are spent on mental health yet. It's such a huge issue for so many people. We all have mental health. And so really wanted to set up an initiative to increase political and financial action globally. As part of that work, we do many things. We convene a global advocacy group to lobby global leaders together. We have formed the Speak Your Mind campaign, which is nationally led by 19 countries around the world, advocates who are calling for change from their governments. And we've seen good successes from those campaigns that coming together even over the last 2 years. It's incredible it's only been 2 years. Just shows the level of demand, but we've got a really long way to go, I think, especially in the context of COVID. So now more than ever, we're seeing the mental health impact on so many people for so many reasons. And this is not only those who are living with pre-existing mental health conditions that we're hearing around the world. This becomes a challenge, as James said, if you can't get to your usual support and your medical providers to maintain. If you live with a serious mental health condition, that's a really concern right now, as well as just we're seeing heightened anxiety and fear, and are really like tracking the knock-on impacts of people's mental health. And we at United are here. We've taken some time over the last few months, along with everyone else, to understand what is happening, how we can respond. And actually, I think, as James said, we need to respond individually. We need to respond nationally. We have to be talking about how important this is to our leaders, because very few are actually responding to mental health and the needs, and actually globally as well. We're not set up to respond and serve the needs of those with mental health conditions before this crisis. It's growing. We have a lot more to do. So that's a little bit about what we do, but it's been a real delight. And part of our work, not only working at that global level, but partnering with YMCA on things like on Speak Your Mind, to bring that global voice, and also to bring it right at a country level. So there are opportunities for YMCAs to get connected in each of those 19 countries, to call and be part of this global movement for change.
Definitely, and a bit of a long-winded question here, but I guess we can have a little bit of a to and fro. But with the implications of the pandemic at the moment on global mental health becoming more and more stark every day, what work, I guess, have you been doing both internally and externally to respond in the short term and plan for what will become the new normal?
Yeah, it's a really good question, and it's been good to have a bit of a chat about this. I want to hear what some of your thoughts on this as well. But in terms of what we've been doing, I think, as I said, I think there are two things that are really front of mind. I think one, supporting emotional health broadly, of particularly employees internally, is front of mind. I think demonstrating leadership is a big part of that. And I know we have a lot of leaders from the YMCA here, so talk a little bit about it as well. To talk about some of the things we've tried to do to make it really practical. I think firstly, just to say, this is really hard. And for any leader out there, I think personally, it has been a challenge, not just to address what's happening outside and the work that we exist to do, but to, I feel like everyone at the moment is up and down every now and then, and that includes me, and that includes, I think, everybody. So I think grappling with that alongside the work has been the biggest. In terms of strategic shifts we've made at United, we play a role as a global convener on mental health for advocacy and campaigning. And we have realized quite quickly there's a lot of information that may not be correct out there. And so we have brought together a weekly webinar series on the latest up-to-date global trusted information on mental health and COVID. And so we run that. It's at 9 a.m. Eastern Standard Time every Tuesday. So we're doing that. We brought that together quickly to get that best information out there. And I think the other thing strategically, we're focusing on really sharing WHO guidance. When you work globally, it's just important to use that trusted sense of information and check in with it. For Speak Your Mind, the Speak Your Mind campaigners across 19 countries, we've brought together, we've shared with each other, supported one-on-one. The solidarity is incredibly powerful. Countries supporting one another in really difficult circumstances. So we've encouraged that, as well as they've wanted to come together and launch a united call to make sure that mental health is integrated into national responses. And so that will be coming soon, and we look forward to sharing that with YMCA for those that really care about this issue. And just a couple of practical ones. We're all working from home, as everyone is. That shift is something we've been working through our team with, and making sure everyone's set up for what they need. Personally, I think just giving everyone a little bit of grace, recognizing the personal challenges of those with families, those with living alone, and really just keeping that communication between everyone really strong. I think being vulnerable and sharing when we're struggling is important as well. There's a lot of other things, but that's just a few of the things that we're doing that are finding really help. And what about you? How are you doing?
Yeah, I guess for me, my former role with the YMCA has kind of shifted. So I finished up my work with the YMCA in London quite abruptly and found myself back home in Australia, unemployed and sort of looking for anything to sort of, you know, take some time up and to sort of feed my interests. And I found myself sort of working with some of the YMCAs here nationally. We've got a number of different associations across Australia, and I found myself working with a number of them, trying to, I guess, inform them about how they can be agile and responding to the needs of young people that they would typically be engaging with, and hopefully more young people. And so, you know, for us, you know, as I hope everyone has, we identified the need more now than ever for us to support, you know, young people in their mental health and their mental well-being. And so it was where we had young people who, you know, hopefully weren't reliant on us, but were supported by us as far as their mental health is concerned, trying to find ways that we can continue to support them whilst also, you know, diversifying our reach. Now, our approaches there was, I guess, a focus of mine and something I'm working on here with our YMCAs, and has been a challenge, but really interesting. And so, yeah, I guess, you know, I'm conscious of time here, Patricia, so pull us up wherever you need. But with the number of leaders we have here from across, you know, a wide range of YMCAs around the world, I want us to know more simply what advice you'd have for YMCA leaders who are trying to grapple with, you know, the coronavirus crisis, whilst, you know, with respect to the mental health of young people.
Yeah, it's a good point. I think just to reiterate, the message I really want to get across is, I think for leaders, I think first acknowledging this is really hard, and both for leaders and teams, it's important to recognize for ourselves, and it's important to recognize with our teams that we are all figuring this out as we go. I think so long as our intention is to prioritize our mental health, as long as alongside the work we're doing in everything we do, we'll get through this and we'll get through it together. And I think much more empathetic leaders, much more there for those that are struggling. Some of the leaders out there may have people who've lost their jobs. That's incredibly difficult. I think some are struggling with a lot of home situations. So I think first, just recognize that this is hard and across the board. I think in terms of responding to mental health, first look after your own mental health. It's really critical. Prioritize that every single day. And then I think also my encouragement will be very aware of those around you. It's very hard to speak up, especially now, especially remotely. I would ask twice how people are doing. And we've got for our team even wellness action plans that outline, look, these are the things to look out for. Have that conversation up front to be able to help spot when people might be struggling, and talk about solutions that help for people individually is really important. And I would also say, I know it's hard when we're individually struggling. We have to look after, make sure that we're well and our teams are well first. But now I think is with the capacity that is there to come together in solidarity and call on our leaders to do more. The Australian government has been one of the few that has incorporated mental health actively within its national response plan, recognising people need that. So there will be calls to leaders coming up very soon to encourage leaders to have that same response. And I think if there are things that you can do for your team, for your local communities, for your national governments, any of those things you can do that within your capacity would encourage people to join in those efforts as well, to help those that may be outside of our reach.
Colin McFarlane asked this question, and this one I'll direct to Elisha and Jayden. In what way do you think we can move our governments and decision makers to focus on early intervention and prevention in the area of young people's mental health, as we seem to have a medical model and wait for issues to arise before there's an intervention?
It's a great question, and I would just say I think now more than ever is the time to make this case, because I do think it is important to have support in terms of medical if that is needed, but that is not the first starting point. It's always promotion of good mental health, early prevention as well. And I think it is it's a difficult message sometimes to make to governments, because they're often trying to respond to what's right in front of them, and often it is those more urgent needs that have been responded to. But it's very clear, and certainly from WHO guidelines, the comprehensive global action plan, promotion, prevention, treatment, and recovery are all very important. And I think now, as we look to, I guess, the need, there are so many more people now that are struggling with their mental health, maybe for the first time. And now is the time to make that case for that promotion of good mental health and early prevention for the masses that are struggling. So I think that's a message that really resonates with governments right now. In a rapid response from the Speak Your Mind campaign, we're looking at what the first ask is: every government should be scaling up national public education campaigns on mental health right now. Mm-hmm. And that's something that some governments have done, but every government needs to hear that message and do that right now, because that's what people need to hear. When it comes to mental health, that is one of the very key messages, alongside ensuring we protect the services that those that do need them, as well as prepare to scale those up as well for the future. So I think it has to be balanced with across those 4 areas, but I do think now is the right time. And so making that very clear to our leaders is something we should be doing now together.
Jayden, how do you balance the desire to achieve constructive or productive work in a day and maintaining PMH, positive mental health, and just trying to get by when the former is intrinsically connected to the latter?
I guess for me, I'm incredibly goal orientated. So when it comes to the productiveness or the constructiveness of my work, I'm always setting out goals and mapping out the path to achieve those goals. But when it comes to the positive mental health side of it all, I guess more importantly now, more than ever, it's really important we are maintaining our mental health. And for me, a priority of mine over the past few years, whilst I was working full-time for the YMCA and traveling a lot, and then also studying full-time, I guess was time management and making sure I did build time in, probably most importantly, to maintain my mental health. And for me, many of you, anyone that attended Y175 has probably heard me speak very openly about my battles with mental illness and suicide. And for me, physical activity and exercise was always the most important part of my ability to maintain my mental health. And so I guess in short, I make sure that, I'm physically active at least every day. But then there's also other things, I'm a really, keen communicator, and I'm always really unapologetic about how I talk about mental health and how I make myself vulnerable, and making sure that I can communicate with other people about mental health. And I guess it's really important, as well. And, Elisha and I were talking about this previously. There's a really fine balance between thinking you can save everyone and talk to everyone, and also making sure you're looking after yourself. And other speakers have said, similar things throughout the evening. So for me, it is really, really important. It doesn't necessarily have to be physical activity, but whatever it is that helps you maintain that positive mental health, you build that into your daily routine. Another speaker at Y175, Jeff Sparr, was talking about his creativity and how he uses painting as, his means of supporting positive mental health. There's a million ways people can do it, and it's really important. But it all comes down to looking after yourself and making sure you're not pouring from an empty cup.
The concept of mental health is an holistic in mind, spirit, and body. In the YMCA, we emphasize the body. Maybe it would be now a good moment to find balance, to meet again with God and with ourselves, and finding a new connection with our neighbors and with nature. How do we face this challenge today, mental health is a very wide concept. It doesn't have borders because it is the normal and the not normal. What are the limits to this?
Yeah, absolutely. I think it's a really interesting question, because when we're talking about our minds, it is impacted by our body and our spirit. And it's, what are the limits? I've never been asked that question before, but I'd be tempted to just say I'm not sure there are that many limits around what we can do. And I think it's individual to a lot of people. When it comes to, for instance, the things that we're campaigning for, we will campaign for things that have evidence-based solutions. So I would focus on those things. WHO again gives really good guidance on what they are, and if we were to come together and focus on the things that really support people, let's focus on those as things we know work. But I would also say I think it's really individual to what it is for you and what it is for your community to have good mental health. So it's a really interesting question, and I do think it is a good time to delve into questions like this, and then also refer to our global mental health experts, who certainly for us and the things that we campaign for will pave the way around things that we know are very helpful.